Heather, my name is Natalie. I'm a nurse practitioner today who's going to be doing an exam on you.
Okay.
Any problems or concerns before we get started today?
No.
No? Okay, great. We're going to go ahead first and I'm going to wash my hands. Okay. So next I'm just going to take a look at your hands, please. And I'm going to turn them over here, just checking skin turgor. Looks like you're pretty hydrated today, so that's good. Now, if you wouldn't mind, I'm going to have you just tip your head forward. Any lumps or bumps or anything on your head that you've noticed at all? No. Okay, good. Now what I'm going to have you do is just some movements with your face. So I'm going to have you smile, frown, stick out your tongue, puff out your cheeks, raise up your eyebrows. Good. Now I'm going to go ahead and just palpate and check your temporal pulse. And I'm going to have you, let me check your sinuses here. Have you open and close your jaw for me. Good. And then I'm going to have you go ahead and shut your eyes and try and open them. Good. Okay, good. Now we're going to go ahead and we're going to do some testing of your vision. Okay, so I'm going to just grab a few things here that I need. Okay, so first thing I'm going to do is I'm going to test your peripheral vision. Okay, so I'm going to have you cover your left eye. And I'm going to cover my right eye. And what we're going to do is I'm going to make some motions, and when you can see my fingers, let me know, okay?
No. No. No.
Good. Okay, let's go ahead and switch. Same thing. When you can see my fingers?
No. No. No.
Good. Okay. Next thing we're going to do, I'm just going to have you stare straight ahead. I'm just going to go ahead and look here. Good. Okay. And now what I'm going to do is I'm going to go ahead and make some motions with my pen light here, and I'm going to have you follow my pen light just with your eyes, so you're not going to turn your head. Okay?
Okay.
All right. So we're going to have you go up. And I'm going to follow it in. Good. Excellent. I'm going to take a closer look here at your eyes. At the outside. Any eye problems or concerns at all?
No.
Okay. All right. I'm going to dim the lights for a second, and we're going to do a little bit more visualization of your retina and your macula, so inside parts of your eyes, okay?
Mm-hmm.
So it's easiest if you can just kind of stare straight off into the distance, and I'm going to be shining this light, okay?
Okay.
All right, we'll do the same thing on the other side. Doing okay? I know it's kind of bright.
Yes, doing fine.
Okay. Good. Okay, looks good. All right, so we'll go ahead and turn the lights back on here. And I'm just going to switch over here. Now we're going to look in your nose and your ears and your mouth. Okay, so first let's check some hearing stuff first, okay? So we're going to just touch and check the outside portion of your ears. Any pain at all as I press on your ear?
No.
Okay. Take a peek in those ears. Looks good. Okay, same thing on the other side. Any pain at all as I'm pushing on your ear?
No.
All right. going to test your hearing. So what I'm going to do is I'm going to actually have you go ahead and plug your right ear, and I'm going to whisper a couple of words into your ear, and I'm going to see if you can hear them.
A, B, C.
Good. We'll check the other side.
1, 2, 3.
Good. Awesome. Now we're going to go ahead and check your nose. So I'm going to have you cover one nostril, take a breath in and out. Same thing on the other side. Good. Now I'm going to take a look inside, okay? So if you can, kind of just hold your breath for a second. Good. Go ahead and check the other side. Take a breath in again. All right, one more. Good. Excellent. Okay. Now I'm just going to grab some additional stuff to check inside your mouth here. Alright, so first we're just going to go ahead and check your lips here. Any dental problems or concerns that you're having at all?
No.
Okay, I'm going to go ahead and feel on the inside of your mouth here. Now I'm going to go ahead and have you stick out your tongue for me. Say, ah. Good. Now we're going to have you do that one more time and gently press down on your tongue. Check out your tonsils. Good. Still have those. Good. Excellent. Okay. All right. Next I'm going to go ahead and check some lymph nodes, okay?
Mm-hmm.
All right. Starting up here. Okay, gonna have you shrug up your shoulders for me and lower them. Good. All right. Next thing we're going to do is we're going to listen to the pulses in your neck and your carotid arteries. So to do that, I'm going to turn my stethoscope to the bell side here. I'm going to have you gently kind of just turn your neck towards me and then take a breath in, and then I'm inhale and we actually have you hold the exhale, okay? Okay, good. We'll do the same thing. Take a couple of breaths in between. And then I'll have you turn to this side. Take a deep breath in. Good. Release that. Just do a couple more to check your trachea here. Nice and midline. And you said you're not having any problems swallowing at all?
No.
Okay. Now we're going to test some muscles. So I'm going to have you go ahead and shrug up your shoulders and don't let me push them down. Good. Same thing. Push your head against my hand and behind. And on the side. And to the other side. Good. All right. Next thing is checking your thyroid. So I'm going to do it in two different ways. I'm going to hand you this glass of water. I'm going to check it from in front of you first. So I'll ask you to take a sip and then to swallow, and I'll check, and then I'll go from behind and do it the same way. Okay? Okay. Awesome. So you can go ahead and take a sip. Okay. Go ahead and swallow. Good. All right. Same thing again, whenever you're ready to swallow. Good. Excellent. All right, now I'll take that back from you. And then we're actually going to have you kind of swing your legs to the side here so your back is to me. Perfect. And we're going to just do some examination and checking of your chest and your lungs to start. So just beginning, just looking at the chest wall, looking for symmetry. I'm going to have you take some deep breaths in and out for me. Good. Excellent. Now I'm just going to kind of run my fingers down your spine here. And then I'm going to have you say the words 99 for me.
99, 99, 99.
Good. Now I'm going to tap on your lungs in different areas, okay?
Mm-hmm.
I'm going to just lift this up if that's okay.
Mm-hmm.
Okay. Just check down at the faces here.
Mm-hmm.
Good. Okay. Next thing we're going to do is I'm actually just going to check Kidneys here? Any pain with this?
No.
Okay. Now I'm going to have you take some big, deep breaths in and out through your mouth. And I'm going to have you do several because the lungs are very big, okay?
Okay.
So we'll start up at the top here. Good. You doing okay?
Yes.
Okay, a couple more here. And then we'll listen on the sides here. Good. Okay, excellent. Go ahead and pull this down here. And then I'd like you to go ahead and swing your legs back around here.
Mm-hmm.
Okay, so now we're going to do more of the assessment on the front of your chest, but I'm also going to be listening to your heart here as well. So I'm first just going to start by listening to your lungs, so you can keep taking those same breaths you were before, just nice deep breaths for me. Good. Okay, now what I'm going to have you do is I'm just going to have you lean forward, and I'm going to just press here, touching gently the top of your heart here. Okay, and then the bottom or the apex of your heart right here. Good. Great. And while you're still leaning forward, I'm just going to listen to your heart here. Okay, and now you can go ahead and sit back. Now we're just going to listen in a bunch of different spots, and I'm going to listen with my bell, or with my diaphragm first, and then my bell. All right, any chest pain, problems, shortness of breath, anything like that you've been having?
No.
Nope, okay, good. Okay, now we're going to have you lay all the way back, and I'm actually going to ask you to lie on your left side first.
Okay.
Just so I can listen to your heart in a slightly different position. Okay, so we're going to listen to it at the apex. So again, right where the apical pulse is. I'm just going to listen here. This position is nice because it can help bring that heart forward. Sometimes it can make it easier to hear, although yours was really, really easy to hear, so that's good. Okay, let's have you turn back over, and now you'll be laying on your belly.
Okay.
All right, so we're going to do a couple of things with your belly, okay? We're going to take a listen first, and I'm going to start first by listening in all of the quadrants of your belly, okay?
Mm-hmm.
And as I'm doing that, I'm just inspecting, making sure that there's no masses or anything like that that I can visually see. Any problems with going to the bathroom, constipation, diarrhea, nausea, vomiting?
Nope.
Upset stomach? No? Okay. Okay. Now what I'm going to do is I'm going to listen to your aorta. So I'm going to listen again with the bell of my stethoscope here. And then I'm going to listen to your renal arteries here on the sides. They give blood flow to your kidneys, which is important. Okay. Now I'm going to go ahead, I'm going to tap on your belly, okay, just to kind of listen for different sounds, okay?
Okay.
ahead and press. And I'm going to press gently first. You let me know if you feel any pain or discomfort in the areas that I'm pressing. And then I'll press a little bit deeper. Any pain at all?
No.
Okay. Okay, now I'm going to check your liver, palpate your liver. So go ahead, take a deep breath in, then exhale, let it out. Press here along that liver edge. Okay, and I cannot feel your liver. Let's go ahead and take a deep breath in, and then exhale, let it out again. This time I'm trying to feel the spleen, which I cannot feel, so that's a good thing. All right, now I'm going to check some pulses, so and also some lymph nodes that are in your groin region.
Okay.
So are you able to show me kind of where your pubic bone is?
Mhm.
The top of your pubic bone?
Yep, right about
Okay.
here.
Okay, perfect. So now, this is a landmark I use when I'm checking pulses. So I kind of go like halfway in between. And then we're just going to check those lymph nodes in your groin, okay?
Mhm.
All right. Good. All right, so now we're going to check some pulses in your feet.
Okay.
Okay, so first I'm going to check the pulse on the side here, the tibial pulse. And then make sure you've got good blood flow to your feet, which you do. Okay, good. Right, now we're going to go ahead and check your calves. Any pain, swelling, any problems with your calves that you've noticed, or your legs in general?
Nope.
Okay, good. Now I'm just going to kind of look in between your toes here. Okay. Good. All right, so now everything looks good there. We're going to test some range of motion. So the first thing we're going to do is I'm going to have you make the movements without me guiding, or I'm sorry, I'm going to guide you first through them, and then I'm going to have you do them independently. Okay? So first we're going to check hips. So up, out, and you have not had a hip replacement?
Correct.
Okay. That, across the midline and back.
Mhm.
Okay, same thing on the other side. Up, out, across the midline, back, and down. Can you do that independently now?
Mhm.
Good. Same thing on the other side. Good. Okay, we'll check knees. So same thing, we'll bend the knee, extend, bend the knee, extend. Okay, same thing. If you can show me that, bend. Perfect. Okay, ankles. So I'm just going to gently flex your feet back,
Mhm.
point them. Any pain with that? Any problems doing that?
Nope.
Okay, so I'm going to have you do that now for me. Good. And then I'm going to have you rotate your ankles out and in. Good. Any problems with that?
No.
Okay, let's have you go ahead and sit all the way up. And now
Okay.
we're going to test the muscle strength in those same lower body
Okay.
muscles. Okay, so going to have you, like you're opening and closing, open your legs, close. Going to have you press up against my hand. And on this side, going to have you kick out your leg, or sorry, yeah, push against my hands, push against my hands. Good. Same thing, like you are pointing your toes, flexing. Good. Okay. Now we're going to move to upper body. So I'm just going to take your radial pulse here first.
Mhm.
Good. All right, now we'll check range of motion. So again, we're going to check the shoulders first. So we'll have you go arms straight up, out, overhead, back down. Any problems with that?
No.
Okay, why don't you go ahead and do that for me? Up. Good. How about swimming? Can you swim okay?
Mhm.
Front stroke, back stroke. Good. Okay. Now I'm going to have you go ahead and open and close your arms, biceps. Good. No problems with that. And then same thing with your hands. Go ahead and point, flex. Any problems there?
No.
Okay, now we're going to test the muscle strength. So you can hold your arms out. Don't let me push them down. Don't let me push them up. Hold your arms up to the side. Don't let me push them down. Don't let me push them up. Okay, making muscles with your arms. Good. Don't let me pull them. Push against me. Okay, with your hands now. Squeeze my hands first. Good. All right. And then I'm going to push against you. And then you're going to push against me. Good. Any problems that way for you?
No.
Excellent. All right. Now we're going to do some neurologic testing. And so I'm going to grab a few things here. So first I'm just going to have you close your eyes and tell me when you feel this.
Now, 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 now.
Okay, good. So this should feel light or soft, dull, I guess we're going to say. And then this should feel sharp.
Okay.
Okay?
Yes.
So I'm going to either do sharp or dull, and you tell me what you feel.
Okay. Sharp. Dull. Sharp. 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 Dull. Dull. Sharp. 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 Dull. Sharp. Dull. Dull.
Good. Okay, I'm going to just put these down here for a second, and then I'm going to give you an object. You can keep those eyes closed. And can you tell me what is in your hand?
It is a safety pin.
Yes, excellent. Okay, now I'm going to actually have you still keep your eyes closed, and we're going to take one finger, and you're going to tell me if it's up or down.
Up. Down.
Okay, do the same thing with the foot.
Up. Down.
Good. Okay, now you can go ahead and open your eyes, and I'm going to have you touch your nose, and then you're going to touch my finger, and my finger is going to move around a bit, okay?
Okay.
So whenever you're ready, you can go ahead. Okay, same thing, keep going. Okay, we'll switch sides. Say the same thing on the other side. Good, excellent. Okay, now we're going to go ahead and we're going to test some reflexes. Before we do that, I'm just going to have you run your heel along your shins. Good? Good, okay. So we're going to start by checking reflexes on your upper body, and we're going to check both sides, okay, just to make sure that they're equal. Okay, whoop. All right. Okay, I'll check your bicep. This one's a little tricky. You want to just kind of let that arm go, nice and limp. Yep, perfect. Okay, and then same thing, like you're letting your arm hang over a gate. Let all the weight come into me. Okay, and find that tendon. Okay, same thing on the other side. So, again, let that arm go here. All right, same thing on this side. All that weight come to me. I'm not as good on this side either, just in terms of positioning. Okay, same thing here. Let that arm go. Perfect. Good. Okay. Now we're going to go ahead and we're going to check your patellar reflex. So I'm going to just kind of get down here. And a very important point for this one is you want to make sure your feet are not touching the floor. So we're good here. All right. Find that tendon. Okay. Same thing on this side. Good. Okay, we're going to check the Achilles next. So with this one, I'm just going to gently place your hand, or my hand, on the bottom of your foot. I'm going to find the Achilles here. Tap that. All right. Good. Okay. Next thing we're going to do is we're actually going to have you stand on up and do some more testing of musculoskeletal system. So first, just I'm going to have you kind of come back here just a little bit more, and I'm going to have you walk just like a normal gait across the room. Okay, perfect. Then we're going to do like you're walking on a tightrope. Perfect. Then you're going to turn around and walk back to me on your tippy toes. And then last time, walking on those heels. Good job. Okay, so how if you come stand here, we're going to do something called a Romberg test. So that's just basically testing your balance and awareness in space. So I'm going to kind of place my hands on either side of you just in case if you lose your balance. And if you go ahead and close your eyes. And a true Romberg test, we would watch for about 30 seconds. We'll probably abbreviate that a little bit here, but no swaying. Good. Okay, excellent. So then, next thing we're going to do is I'm going to have you hold on to the side of the exam table. And we're going to do one just shallow knee bend on each side. Yep, good. Same thing on the other side. Excellent. And then I'm going to have you turn around and face with your back to the camera. I'm going to have you bend down and touch your toes for me. And as you're doing that, I'm just once again checking your spinal alignment. Good. I'm going to have you stand up. And then we'll do some spinal twisting. So side to side. Then to see if you can extend just a little bit back. And then laterally. One side and then the other. Very good. You can go ahead and have a seat. You had your exam today was normal, Heather. And so now what I'm going to do is I'm going to present, if you don't mind, I'm going to present to my preceptor like I would be in a clinical setting. Are you okay with that today?
Yes.
Okay. So this is Heather. She's a 39-year-old Caucasian female who came in today for an annual wellness exam. She reports no problems or concerns. Her past medical history is significant today for PCOS, which stands for polycystic ovarian syndrome. She's had 2 hospitalizations in her lifetime. Both were childbirth, one in 2014, one in 2017, and she's never had surgery. She has no known drug allergies and no environmental or food allergies. She takes no medications, prescription medications. She will take occasionally ibuprofen or Tylenol, and she does take a daily multivitamin. She's married, she has a male partner, and in a monogamous relationship. Her risks today for HIV and STIs are low. She's a nurse practitioner and works as a nurse educator. She denies any occupational risks or significant work or financial stress today. She lives in a single-family home with her husband and 2 children. She has never smoked. She doesn't use illicit drugs. She drinks 1 alcoholic beverage approximately once a month. And she consumes 1 soda per day, usually a Diet Coke. She's a practicing Catholic. She has no spiritual concerns or cultural beliefs that would impact our care today that we're providing her. For her family history, going back 2 generations, her maternal grandfather is deceased from heart disease at 80. Her maternal grandmother is also deceased from heart disease and diabetes. She was 82. Her paternal grandmother, is deceased from heart disease at age 80. Her paternal grandfather is deceased from heart disease, and he also had pancreatic cancer. He is deceased at age 75. Her mom has hypertension, and she's also deceased at age 65. Her dad has hypertension, melanoma, and chronic leukemia. He is living at age 65, and her sister is living at age 30. She has no major medical issues or problems. Today, Heather is due for her COVID-19 booster and her annual flu vaccine. She does exercise regularly, which is awesome. Good for you. She exercises 20 to 30 minutes, 2 to 3 times a week, and she's usually running, jogging, or walking her dog. She follows a standard American diet. She has no dietary intolerances, restrictions, or allergies that she's aware of. She sleeps about 6 to 8 hours per night, and she manages her stress through walks with her dog and listening to Disney music. She had her last physical 1 year ago in 2021. She had PAP and HPV co-testing at that time, which was negative, so we would not be doing that today. Her last dental exam was 4 months ago, which she indicates was negative, normal. Her last eye exam was 1 year ago, normal. And based off of her age and risk factors, she does not need a mammogram or colonoscopy today. So her her review of systems were normal. There were no significant findings. Her physical exam also today was normal. So she is a well female exam, and recommendations for today would again be the health maintenance, which she is up to date on, with the exception of her immunization. So we will get that done today.